Hello, this is Dr. Shantella Raynor, and I'm here to talk about something that I have to have a lot of conversations about. It's just a part of um, what I do as an acupuncturist, and I think it would be a really valuable piece of information to share with those of you out there maybe who are considering acupuncture and TCM to support your chronic health conditions. So, what I want to talk about today is, a lot of times people will ask, well, why can't I just come once and then be done? Like, why can't it just be a one and done? So, and this is one of the biggest questions that people ask when they start acupuncture is, how many treatments am I actually going to need? So, honestly, there isn't one answer. So, let's talk about it. All right, so the answer is it depends. It depends on what we're treating, how long you've had the problem, uh, how severe it is, your overall health, how your body responds to the treatment, and what your goals are. But when we're talking about chronic conditions, I often think about care in phases. When you think about a chronic condition, usually, you've been dealing with it for weeks, possibly months, possibly years. So if you've had a decade long stint with, like pain or insomnia, then, your body has learned a certain pattern. It's really become a habit. It's become a state that your body is inhabiting, and you can't expect that kind of patterning, that type of habit, or that state to be resolved overnight. The same way that you didn't have insomnia or you didn't have chronic pain at one point, your body unfortunately learned that condition and how to inhabit in that condition. So, likewise, it's going to take time for that condition to be unlearned and for your body to heal from it. So, when I think about the phases of treatment, the progression looks something like this: there's a relief phase, a restoration phase, and a maintenance phase. The beginning of care with that in mind can look very different from what care looks like once you've achieved significant improvement. And that's important because acupuncture isn't necessarily a one and done treatment. And this is actually true for a lot of natural therapies, because we're working with the body's natural healing abilities and with the understanding that we're trying to create a change in a pattern that's developed over weeks or months or sometimes years. This, I think, is more practical. It's more practical sounding and it makes sense. So let's talk about what those different phases can look like. Okay, the relief phase. So when you're dealing with a chronic problem, the beginning of treatment may require more frequent visits. Okay, so the initial goal is often to create meaningful relief and get some momentum going. Um, Depending on the condition and the individual, that may mean treatments once or twice a week, or sometimes more frequently in certain clinical situations. So, again, um, depending on the condition, the individual may need multiple treatments a week, and the exact schedule should be individualized. And research for specific conditions can help inform that treatment frequency for sure. But the basic idea is that we're giving the body repeated therapeutic input rather than expecting one treatment to undo the whole chronic pattern, okay? And we're also watching what happens during this relief phase. Um, are your symptoms changing? Is the improvement lasting between treatments? Are we seeing a trend? That's what helps us determine where we go next. This is actually a conversation I had today with an insomnia patient. And, you know, we're looking at, this is something that this particular person has dealt with for over a decade, most of their life actually. And so we're, instead of, trying to get relief all in one treatment or in a few treatments, each treatment that they come to, we're assessing, is sleep improving? Is the quality of sleep improving? Are the numbers of hours of sleep that you're getting, is it improving? Do you notice that it's easier for you to actually fall asleep at night? That's like in real time the kind of observations I'm making and questions I'm asking the patient that's coming in for something like a chronic insomnia condition. And the same thing goes for chronic pain and other chronic conditions. That's what helps us determine where we go next. Okay, let's talk about the restorative phase. So you're at the point to where you've gotten some relief. Now what? So this is where the goal starts to shift. During the initial phase, we're often focused on getting symptoms under better control. But once we're seeing meaningful improvement on those symptoms, on those underlying patterns, we can start thinking about what I like to call the restorative phase. So we're asking questions like, can we maintain these improvements? Can we start addressing contributing patterns? Can your body maintain the progress for longer between treatments? And that's where we can begin gradually spacing out visits. Maybe someone who initially needed more frequent visits, like twice a week, 3 times a week, can move toward a once a week visit. And eventually we can see whether they can maintain their progress with even more time between treatments. And the goal isn't to keep you coming twice a week forever. The goal is to see what level of care your body actually needs. Okay, does getting acupuncture for a chronic condition mean you have to get acupuncture forever? Not necessarily. So some some people reach their treatment goals and don't need ongoing care, and other people find that periodic acupuncture is helpful as part of their overall wellness. And this is where we get into the maintenance phase. So instead of treating an active problem every few days, someone might come periodically. So perhaps every few weeks or once a month, or depending on their individual situation. And sometimes maintenance isn't really about having a diagnosis. It may just be about supporting someone whose lifestyle puts a lot of demand on their body. So if you're a hairdresser, an athlete, a mechanic, a construction worker, a massage therapist, or really anyone whose body is part of how you make a living, your body is one of your tools. So think about it. You maintain your car because you rely on it, right? You maintain your hair, you have routines for your skin, you replace things when they wear down. So why do we sometimes expect our bodies to just keep performing indefinitely without maintenance? You know? For someone whose job requires them to stand all day and to use their hands constantly, to lift, to bend, reach, or perform repetitive movements, their muscles and joints are under a particular kind of demand. And acupuncture can be one of the components of a broader wellness recovery routine for some people. And that's how I think about maintenance care. It's not necessarily about saying something is wrong with you and it's, that you have a diagnosis or anything like that. Sometimes it's simply about saying, this is my body, I rely on it, and how can I take care of it? So here's something I think is really important. Not everybody needs maintenance acupuncture. If you complete a course of care, you're doing well, and you don't feel like you need ongoing treatment, that's okay. My goal as a practitioner isn't to keep you coming forever. My goal is to help you make progress and then figure out what level of support makes sense for you. Some people may do well with occasional treatments. Some people may prefer regular wellness visits, and some people may only come back when something comes up. And some people have lifestyles or recurring concerns where periodic care makes sense for them. So, the important thing is that maintenance care should be based on the individual, not a one size fits all schedule. And your treatment plan should evolve as your needs evolve. So, one thing I wish more people understood about chronic conditions is that we have to change the way we think about treatment. If you've had a problem for 6 months, 2 years, 10 years, it may not be realistic to expect one treatment to completely resolve it. That doesn't mean acupuncture can't help. It means we're working with a system that's had a lot of time to develop a particular pattern. So instead of thinking, did acupuncture fix me after one treatment? I want you to think, are we seeing a trend? Is the pain becoming less intense? Are the good days becoming more frequent? Are you sleeping longer? Are your symptoms taking longer to come back? Are you recovering more quickly? Those changes are the ones that really matter. And that's why following a treatment plan and tracking your response can also be important when we're working with chronic change. Your acupuncture treatment plan shouldn't necessarily look the same 3 months from now as it did on your first visit. So think about what we're trying to accomplish. At the beginning, you may need more frequent care because you're trying to get a significant symptom under better control. Then, as you improve, we may be able to space treatments further apart, and eventually we reassess. Do you still need weekly care? Would every couple of weeks be enough time? Would monthly maintenance be helpful? Or are you doing well enough that you don't need to come in right now? That's why I like to think about acupuncture as a progression of care rather than just a series of individual appointments. We're continually assessing your response and adjusting the plan. And ultimately, that's what individualized care is supposed to look like.